Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Hello, everyone. Welcome back. Welcome back. This is Dr. Thomas Grubb. This is Living Pain Free. Dr. Darrow's away from us here this week. Love to give you guys a chance to talk to us live in the studio about your musculoskeletal orthopedic needs. What we're talking about is regenerative medicine, maybe platelet-rich plasma, PRP, or stem cells might be a good option for you. What we do, we use injections to actually inject directly into injured areas, get your tissue to heal itself up, and hopefully keep you out of the operating room. That number to call, talk to us live. Don't be shy. Use a fake name if you need to. We're at 866-870-5752. That's 866-870-5752. We'll give you guys a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Great place to start. Good stories in there, good studies in there, good case reports looking at how regenerative medicine heals tissue, keeps people out of the operating room. And even if you had a surgery, maybe you had a complication, we see people every single week that have surgeries that we just truly don't think are necessary. We do a physical exam, and we find that the source of their issues are not actually where the surgery was done, unfortunately. We see a lot of those sort of mishaps just because a lot of people are not using their hands to examine patients. So we talk about that with all of our patients, how important that is. If you're coming in, we're getting hands put on you, right? We got to do a physical exam. We got to tease out where that pain is coming from. We also want to give you guys an opportunity to give a free consultation with our staff over the phone. That's 800-300-9300. Again, get a free consultation with our staff over the phone. They're waiting by right now. Give us a call. We're at 800-300-9300. Another great resource for you to check out. So much information. What is stem cells? What are platelet-rich plasma? What sort of things do we treat? What do these procedures look like? Check out our website, www.jointrehab.com. That's www.jointrehab.com. There's a spot on every single page for you guys to email us. We answer emails morning, noon, and night. We're very, very available. We even give our cell phones out to all of our patients, making sure that we can close those communication loops, make sure we're talking to you, figuring out maybe if injection therapy would be an option for you, help you through your healing journey. It's really been an amazing opportunity to help patients. We had a really fun week this week. I'm sure Doc wouldn't talk about it if he was on the air today, but pretty cool milestone. 25 years he's been on the air here. Really awesome to be a part of. The guy is an absolute pioneer in the field of regenerative medicine and the movement that he's created. I'm very proud to be a part of that and continue that because it's important, man. This is important work. We're trying to actually get people healed up and keep them out of the operating room. What we do is such a feel-good part of medicine because we actually get to truly heal people. I wish we could make some statements about how much credit we can take about it. Really what we're doing is we're just taking your body's own healing cells and reintroducing it back into the body and getting some healing going for you. But it's a very feel-good thing to do to heal people. It's an absolute privilege to be a part of that movement. So big shouts out to Dr. Darrow on what he's been able to accomplish. Amazing stuff using cells, right? Using platelet-rich plasma, doing a simple blood draw, concentrating down those platelets and growth factors and injecting it back into the body, or using stem cells, using bone marrow aspiration, using a small needle, getting some of that bone marrow out of the back of the pelvis. We can spin that down, lots of good stem cells and platelets and something like that, and we can introduce that directly into an area that's injured. And again, we inject head to toe. We had a lot of great treatments this week. Small fingers of the hands, little toes, the backbones, deep neck injections. So I really have an awesome opportunity to use musculoskeletal ultrasound. I'm blessed to have that treatment. I'm blessed to have the training in that where we can actually use that as our eyes, which allows me to inject areas all over the body very safely using very small needles. So it's a really awesome tool. It's also super fun to watch the patient's light eyes up. then when they actually see their own tissue. So that's pretty neat, because when we're doing a scan in real time, it's me doing the scan. I've got the screen right in front of me. I'm moving your body parts around. We can actually see right on the screen in front of us what we're dealing with, which is a really good kind of mind-body connection as well. I think that's a huge benefit for patients, and it's not super inconvenient. I've still got a couple of patients. I'm waiting on MRI results. We ordered them, 6 months ago, 9 months ago. Ultrasound, bam, you're right in the clinic. We're doing it in real time. So it's pretty fun to be able to do that. We've got a good email here that we can discuss. Again, send us an email through our website, www.jointrehab.com. This is what we talk about in the radio show. This is where we try to reach out to patients and try to figure out if regenerative medicine is a good option for them. Looks like the email says, I've got chronic posterior tibial tendonitis in my right ankle. I want to try Prolo since physical therapy isn't helping. I've had Prolo on my SI joints and it worked great. I stand for a living, so I need to be on medical leave. My question is, how many injections do you do to an affected area? So this is a good opportunity to talk about some anatomy here. Posterior tibialis, it's a little tendon that runs by the ankle on the inside of the big toe side of that ankle. It does a couple of things. Allows you to kind of invert that ankle, plantar flex, meaning you're putting that foot down on the gas pedal, right? It also is a part of something called a medial longitudinal arch, or one of the arches on the bottom of the feet. A very, very common area for us to inject. Now this one's near a pretty big nerve called the posterior tibial nerve. They run kind of right next to each other. So this is another one that I love using ultrasound for. And to answer, how many injections do we do? Really depends on what sort of symptoms, what pathology that you have. I mean, you could just have a little bit of inflammation in one part of a tendon. You could also have a pretty big tear that's through a large area of that tendon, right, where you're having symptoms, above, at, and below the ankle joint. So it really depends on the area that we're going after. Sometimes we can get after it with one or two injections. Sometimes we do a couple more. But the benefit, again, of using ultrasound for an ankle like this, I can use a tiny, tiny little 30 gauge needle, way smaller than a flu shot size needle, where we can introduce these cells directly into that area and get it healed up. We see a lot of feet problems, right? Ankles, things in the feet, things in the shins. All those things are interrelated, obviously. I had some good patients this week with some plantar fascia issues. I'm sure you guys have heard of plantar fasciitis. Sometimes you get pain on the bottom of that heel. This is something that, might, come up if you're not used to doing maybe some running, some jogging. This is something I've had flare up a couple of times if I'm doing like a long hike and I haven't done a whole lot of distance recently. But that plantar fascia, it's actually continuous, or it's connected to the Achilles tendon on the backside. So that, a lot of times that sort of fascial sling will be affected on the backside where your Achilles tendon is. So I always make sure that I'm looking for any pathology in that area. But if you're looking at things like foot pain, very, very important you're doing a physical exam. The hands and the feet, they're a very concentrated area of anatomy. There's just a lot of stuff, a lot of structures, right? Ligaments, tendons, muscles, soft tissue structures, a lot of joints, a lot of little ligaments between those joints in that area. So it's very, very important that we tease out where that painful area is coming from. I had a gentleman last couple of weeks, we're treating some pain on the bottom of his foot. So we had some strain of a couple of the foot arches. So people always think, I've got high arches, I've got low arches. There's only like one arch in the foot. There's actually a couple of arches in the foot. We call them longitudinal arches. They run from the heel bone all the way to the toes. One's on the inside. We call that the medial longitudinal arch. There's one on the outside of the lateral longitudinal arch. And there's one that is called the transverse arch. So it's kind of over the ball of your foot. So there's kind of like a triangular sort of shaped structure that gives some stability to that foot. You think about all the forces that go through a foot when you're walking, sprinting, running, jumping. So there's a lot of really fun anatomy in that area that we can tease out where you're having your pain and discomfort. So this is somebody who we actually had some issues with all of those arches and the plantar fascia. So a couple of pokes, again, very well tolerated. Again, we're using very, very small needles. I always try to, reassure patients that it's not going to be this super insanely painful process where I'm using these huge needles. Nothing like that. I'm using the smallest needle possible to get the job done. And again, because I'm using ultrasound, we can be very, very specific where we're placing those cells. And what we like to do for things like that too is we'll put them into a walking boot. That's a really great tool to help kind of offload that area and allow that tissue to heal. This is a good chance to just to talk about, well, hey, I had some treatment. Why am I not getting the results that I'm happy with? We see a lot of problems with the aftercare, right? So again, how this stuff works is when we inject and we create inflammation, we've got to let that area heal itself up. So even if you feel a little bit better, a day, a couple days after, a week or two after, we'd really rather give you a little bit more time until those symptoms are really shored up, and that those new cells, right, that new tissue that's actually growing, give it a chance to mature. And we like to use that analogy, right? You put some grass seed down, don't go and step on it right away. You want to let that grass thicken up before you go and beat it up again. That's a pretty common reason, is people are just too active too soon, right? And sometimes we just need a little bit more stimulus. Sometimes we need a couple more cells in there. So sometimes multiple treatments are necessary for an amount of healing. So sometimes you're better after one. Certainly we get patients like that. But again, sometimes you need a couple of rounds and some more time to have enough tissue to actually heal itself up. Another really common reason why people don't get great results is going to be something that actually blocks the healing. Those are things called anti-inflammatory medications, specifically the drug class of corticosteroids. So things like a prednisone pack, if you're having a respiratory infection, you're popping high doses of steroids, or just local steroid shots. Those are things that actually block the healing because they're a very powerful anti-inflammatory. But again, remember, we need inflammation to actually get that healing process started for you. Another reason is going to be the non-steroidal anti-inflammatory drugs, or the NSAIDs. That's going to be your things like, Motrin or ibuprofen or Aleve. Prescription strength would be things like Celebrex or Meloxicam. Very, very common prescribed medications. Any sort of pain that people have, I feel like these medications are given out like candy without a proper warning, right? Lots of very scary side effects for these medications, especially at high doses, especially if you take them chronically, right? So just because you can get something over the counter doesn't mean it can't cause a lot of issues for you. Thinking back to my ICU days, the amount of gastrointestinal bleeds, right? Big, bad stomach ulcers that are caused by things like chronic NSAID use, right? People think, just, pop a couple ibuprofen every day, not a big deal. But we know it actually kind of wears out the lining of the stomach and the intestines, can cause things like bleeding, GI upset. Also not great for the kidneys, things for small vessel disease, things like heart disease. They're not great for that either. So we'd much rather try to get some healing going instead of just masking and covering up those areas. I just mentioned steroid shots. That's another one that just, in our opinion, is just wildly overused. We're not big fans of doing those. Again, we know that we get a lot of research that steroids actually limit your body's ability to heal. So if you put it into something like a ligament or a tendon, right, you're going to cause things like tears and ruptures. If you especially chronically put a lot of steroids into joint spaces, so if maybe you've got some knee arthritis and you get talked into a steroid shot, and then you go back, then you have another steroid shot, maybe it doesn't last as long, you have another steroid shot. We know that these substances actually wear out and degrade the articular cartilage. What does that mean? You're actually accelerating your arthritis, which is really what we're trying to do, is regrow and rebuild your articular cartilage, which is at least in part of what causes pain for people with arthritis. So it's not a great option. Again, the pain relief a lot of times is very temporary. We'd much rather go in and try to regrow some of that tissue and heal it from the inside out. It's just a much safer, better long-term solution, with the goal being hopefully to avoid surgery for you. I'm going to give you guys a chance to talk to us live in the studio. We love talking to our callers. Give us a call. We can talk about your musculoskeletal and orthopedic injuries. Number to call is 866-870-5752. That's 866-870-5752. We're going to give you guys a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We even pay the postage for you on that. Give us a call here if you want a free consultation over the phone as well. Our staff's waiting by the line. 800-300-9300. Again, get a free consultation with our staff over the phone. 800-300-9300. And check out our website. Read up about what platelet-rich plasma is, stem cell therapy, actually watch videos of us doing these procedures. Take the fear of what regenerative medicine can be for you. Lots of great research on that website as well. And there's a spot on every single page to shoot us an email. We want to make sure we're getting you help if we think you're a good candidate for this, and give you some direction and help you along your healing journey. That website is www.jointrehab.com. That's www.jointrehab.com. Great place to start for you guys. Lots of great information on there. Very well put together. But we can go back to an email that I got here recently. Looks like we've got someone with some shoulder pain. This is a patient who sent us an email, says, I've got shoulder labrum tear since 2018. Another doctor told me I would be a good candidate for stem cells with bone marrow and PRP. I've got an old MRI from 2019, another one from 2023. I would like to know how many injections that I would need. So first of all, it's great that someone's even considering regenerative medicine. Unfortunately, we're not getting a ton of referrals from surgeons. A lot of people don't know that regenerative medicine is a real option for them. They're not up to date on the current research that's out there that addresses things like musculoskeletal injuries. So this is an individual who says they have a shoulder labrum tear. My biggest question is the labrum tear actually causing your symptoms? We've got great studies showing that people have labrum tears where they have no symptoms whatsoever. And typically with things like labrums, whether it's the shoulder or the hip or something like a meniscus tear that's in the knee, typically it's like the extent of the tear will kind of correlate with somebody's symptoms. So if you've got a giant tear and it's flipped into the joint space, that can certainly cause symptoms for people. But we see a lot of, not so serious tears that don't cause symptoms for them. And then they end up getting chased down with surgery, and then they end up having worse pain than they ever had. So again, the big thing that we'd want to do is get you into the clinic, do a proper hands-on physical exam, stress those tissues out. We see a lot of, rotator cuff issues in the shoulder. So the rotator cuff is a set of 4 muscles that crosses that joint, allows you to move that arm, up against your side, put your hand in your back pocket, touch your opposite side shoulder. We've also got things like the AC joint that connects the acromion with the clavicle or the collarbone. That can be a source of pain for people. There's a lot of little ligaments between all these bones that can cause pain, certainly. You've got the bicep tendon that runs in the front side of the shoulder here. It causes a lot of pain for people. Sometimes it's just as simple as a joint capsule sprain. If you've got a little trauma where you maybe overdo it in the gym, maybe you have a fall and catch your shoulders, lots of different things that can flare up these tissues. Again, for us, that's such a simple thing to address, and we would never, ever want to do surgery on an injury like that because a lot of things can be healed with your body's own cells, right? So, not chasing down an image result is something that I think is just a little bit better, right? We want to really fine-tune where someone's pain is coming from. And again, using MRIs, that's a great resource that we can rule out some big things, right? God forbid you had a cancer, big bone fracture, things like that, certainly. So those can be useful. We like to get them on our patients. But in terms of, soft tissue structures, this is someone, if they came in the clinic, I'm going to put that ultrasound on them. Again, about a minute, we're going to scan those structures, stress those tissues out, and see exactly where someone's pain is coming from. We got a lot of patients who come in and they've got labrum tears, and we don't do anything to the labrum. We actually inject outside of the joint because their pain might be coming from a different area and their pain gets better. So again, very, very important that we don't get really dialed into what we find on an image, right? That pathology. We'd much rather be interested in what the reality is, what it's the true source of somebody's pain. So that's a pretty common one that we see in the clinic there. And, how many injections would you need? Again, it depends on the area that we're injecting. Typically the shoulder, there's multiple things that are causing pain for somebody. So typically it's a couple of pokes that we do. But again, the fear of like, oh my gosh, I don't want to have a bunch of injections into an area. When you're using big needles, I totally would get it because I wouldn't want to have injections either. But because we're using ultrasound, I can use very, very small needles. Typically, if I'm injecting an area, I really only feel that first tiny little pinprick. And then as we put a little bit of numbing into that area, you don't really feel the subsequent injections. A lot of times, too, it's just the pressure of the fluid that just feels a little bit, new for you because we're putting a very small amount of fluid in an area that you're just not used to having. So typically, it's just a little bit of pressure that you have. In terms of that healing journey, right? Again, compared to things like surgery, man, this is nothing. We've got a lot of people who have surgery and they go through treatment with us. They're like, oh my gosh, this was nothing. Really what you're looking for in terms of what to expect after treatment with us is some soreness and stiffness. And again, that's just that inflammatory reaction that we're getting after we're introducing these healing cells into the body. And some people are sensitive to it and they can feel it. I've injected multiple spots all over my own body, wrists, shoulders, knees, ankles, and my big toe. Thumb, wrist, things like that. Sometimes I feel it, and honestly, sometimes I really don't. What we like to do is apply heat to that area. We love heat for healing. We're not a big fan of using things like ice because, again, a little bit into the science of how this stuff works. When we're injecting these cells, what we're doing is actually creating a little injury signal. So it's kind of like a little homing beacon to turn on your body's own cellular healing, right? So things like stem cells will come to that area. Things like growth factors will come to that area to assist in that healing process. A lot of times what it'll do is it'll come in through the bloodstream. So we want to actually keep the blood vessels nice and open, are called vasodilated, and heat is a great stimulus for that. Plus, in terms of that stiffness and soreness, a lot of times it'll kind of loosen that area up and give you a little bit more relief in those first couple of days after an injection. But what we don't want to do is, again, take those medications that block that sort of process, right? Those anti-inflammatories, we want to stay away from those if we can. But typically after a couple of days, that'll go away. Then we do a follow-up appointment with you after a few weeks and see how your body's progressing, right? Re-stress those tissues, do another physical exam, see how you're feeling. And if you're happy with where you're at, we gently get you back into some exercise. But what we're not looking at here is going to be, months and months of immobility where you're not moving whatsoever, or you're in like a sling or a cast, something like a big surgery. Sometimes you need things like that. I think about a couple of Achilles tendons that I did this week. That's another one that, man, you have a surgery on something like that, you are going to be out of commission for quite some time, right? So this is something that's much, much shorter in terms of the recovery time, very, very safe to do. And really, it's as natural as it gets. We're just using your body's own healing cells, introducing it into an area to get some healing, whether we go with platelet-rich plasma or we go with stem cells. Both are great options. Stem cells are a little more potent in terms of the healing that we see, but PRP is certainly a good option for you. I want to give you guys a chance to talk to us live in the studio. Again, give us a call. If you have an ache or a pain, you're a loved one, maybe wants to find out what's going on, give us a call. We'll chat. 866-870-5752. That's 866-870-5752. You can give us a call, and we'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We even pay the postage for you on that one. Give us a call if you'd like a free consultation over the phone with our staff. That number to call, 800-300-9300. That's 800-300-9300. And if you want to see us doing these procedures, check out some of our research behind regenerative medicine. A fantastic resource is our website. That's www.jointrehab.com. That's www.jointrehab.com. Spot on every single page. You shoot us an email. Again, we want to make sure we're getting you connected. See if stem cells and platelets might be a good option for you to heal the tissue instead of operate on it. It's a really fun time that we have in the clinic, healing patients every single day. I feel so blessed that I've got the opportunity to use these cells to heal the body, to have an awesome, awesome staff. Love our staff. Very, very positive environment to help you, get you on your way to your healing journey. Go about it the natural way and heal from the inside out. Got another email here we can go over. This is another really common one too. My name is, not going to say his name. He's from New Jersey. I got recommended to you by a friend who lives in Los Angeles, who is your patient. Awesome. He said that he has a tendonitis issue, wants to get treated by stem cells. He thinks he's got a tendonitis around his elbow from over a year now, looking for a consultation on the process. So for things like elbow pain, this is another example where it could be coming from the joint. There's actually a couple of joints in the elbow where there's two forearm bones and they meet the arm bone called the humerus. So all those have their own little joints there. All those have their own little joint capsule. There's also little ligaments that connect all those bones together. And there's a lot of muscles that cross that joint as well. Really common areas are things like tennis elbow or golfer's elbow. This is where the little wrist extensors and wrist flexors attach on the inside and the outside of the elbow. Extremely common area that we inject. Again, what we try to do is use an ultrasound to pinpoint where we think that pain's coming from. But already done with the show here, guys. Again, thank you so much for tuning in. If you guys want to get a free consultation with our staff over the phone, don't be shy. Give us a call. We're at 800-300-9300. That's 800-300-9300. And if you want to shoot us an email, check us out doing these procedures. Check out our website. We're at www.jointrehab.com. That's www.jointrehab.com. See you next week.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, Don't Operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.